Talk about cardioversion versus defibrillation. Let's look at the core differences between these two treatments. So first is the shock. Cardioversion is where a synchronized shock is delivered only during R wave of the QRS complex. The keynote here is it's a synchronized shock. And for defibrillation is when an asynchronous shock is given. This is done with an AED, an automated external defibrillator. Again, the keynote here is it's asynchronous. Okay, let's look at the joules, which is also known as the energy used in these treatments. So cardioversion has a lower amount of joules used or a lower amount of energy used in the shock. Where defibrillation, we are using a higher amount of joules or a higher energy when the shock is given. Okay, now for CPR. So cardioversion is not done with CPR. Where defibrillation, CPR is used. You resume CPR immediately after a shock is given in defib. Now let's look at why these different treatments are used. So cardioversion is more for our stable clients. Remember, they must have a QRS complex in order for the synchronized shock to be given. Examples of these are AFib patients. So you can think cardioversions are carefully planned. They are for our stable patients, so we are going to set up an appointment and plan for a cardioversion to be given. Defib is for our unstable clients. Examples of this are ventricle tachycardia or VT or VF, ventricle fibrillation. So you can remember this by thinking defibrillation is for deadly rhythms. You can find more information like this in the Complete Nursing School bundle. Happy studying, future nurses!